that really differentiates us is we have pretty much a painless laser hair removal machine. Now, I got laser hair on my back with the old technology, and I'll tell you, you want to torture somebody, tie them down, give them laser hair. Oh my God.
You're like sweating. I've had like my armpits done. You're sweating by the time you're off the bed.
And is it a long procedure?
That's 20 minutes of fucking hell.
Yeah, it's awful.
Yeah. Oh my God.
Yeah.
Yeah. So that's the
what is it like?
technology.
I don't know if you have any tattoos, but like a tattoo. Is it like a tattoo gun? That type of.
It's like
She's got
rubber
tattoos.
bands. Just my parents. Don't know. It's like rubber bands, like painful, like with electricity at the end. Like it's just
literally
like,
feels like you're just slowly burning each part of your skin. Like,
it's bad.
It's terrible.
You ever put your hand on a hot plate?
Yeah.
That's what it keeps feeling like.
Oh, that's awful.
Yeah, it's terrible.
So what's the difference with the technology that you have?
Well, it's still the gold standard is an Alexandrite laser for laser hair, but it's just the manufacturer of this product or the device found a way to make it pain-free. I don't know what this. If you even
is it really like pain-free? That's
you might feel like a warm stone, but
which is fine.
Yeah, and I mean, even if you do feel a little bit of pain, it gets turned down. The efficacy is the same.
Yeah.
The effectiveness is the same.
That's great.
It's game changing. I mean, we were doing like, maybe 20 or 30 patients for laser hair removal a month before. Now we're doing like 200.
Get out of here.
Yeah. I mean, people come in to get their, a Brazilian done. They're like, I'm only going to try this. And then all of a sudden, like, oh my God, I want to get my legs, my arms.
Yeah.
So that's been awesome.
Now, with that, for the people that don't know that might be interested in that, how does that work as far as like time? What does it take for time? And then do they go multiple times?
Yeah. And what's also great about this technology compared to the other ones is you can do it during the summer. It doesn't matter if you have a tan or not. A lot of the older technologies, if you were in the sun, then you're more likely to get burned.
Oh my God. I remember, I think it was last summer, at some point, Nicole did some hair removal thing on her legs, and she would have her legs covered up with towels all the time.
Hey, that's a good patient right there.
Yeah. She's like, I'm not messing with it. I don't have to do it again.
Yeah.
So you don't have to do that as much?
Yeah.
Okay.
Yep, exactly.
Yeah, so you go, I mean, depending on the area size, but anywhere from 5 minutes to, if you're doing like a guy's back, it can take upwards of like 50 minutes.
All right.
And then you usually do it, I mean, we sell them in series of 4 because some people see full results in 4, so you do them spread a month apart.
Okay.
Usually up to 6.
Up to 6, yeah.
All right.
So, yeah, and then...
I've got my arms, I've got my legs, I've got my
Do you really?
chest.
He has less hair in his body than I do.
Your legs?
Feel that. I don't shave my legs, no. I laser hair my legs.
Oh, yeah. No, I'm not very hairy.
Yeah, no, you're lucky.
Yeah. Irish, not very hairy over here. All right, so laser hair removal. What are the other big?
Yeah. I mean, so our biggest thing is when a patient comes in, they may say, oh, I just want my lips done, or I think I need tear trough, which is a type of filler under the eyes. But whenever somebody comes in, just the state of New Hampshire requires a doctor or an NP to do like a medical consultation.
Okay.
And within that, we also do a full facial assessment.
Okay.
So it helps, I mean, obviously within reason. If somebody's not concerned with different areas of their face, we're not going to call that out. But we just try to educate them on the overall aging process.
You're like, wow.
Yeah.
I know you're thinking this. But.
Okay, well,
I mean, here's the
we don't want to
reality,
offend
right?
anybody.
If someone comes in and they're looking to get their cheeks done, but their jaw looks terrible, then people are just going to keep on looking at their jaw.
Yeah.
So we specialize in facial balancing, making sure that where your insecurities may lie or where your imperfections may lie, we just try and perfect them and bring them out a little bit better.
Okay.
Yeah.
All right.
So fillers, laser hair, we have like CO2,
That's
skin
the other big
resurfacing.
thing that we have that's really differentiating is that it's a CO2 laser. So basically, think about trying to sand a floor.
Okay.
Right. You might have some imperfections in there, right? Some rough edges, and then you're going to take a sander to it, right, and make it nice and smooth.
Yep.
So the CO2 laser does the same for your face. You might have little small wrinkles, you might have little small blemishes, and it basically just completely lasers off the first layer of your skin.
Oh, get out of here.
And kind of sands it down.
Yeah.
And most people, when they think of CO2 laser, sometimes you even have to be put under because of how painful.
I was going to
just
ask, is there pain
trauma.
with that?
But this laser, although it can be like ablative, which is sort of as intense as you can get.
Just sounds like a blade of just.
Yeah.
It's about like seven, maybe 10 days of social downtime, but it's like significantly less. I would say at least half of what you would get with a normal laser, but just as effective.
Yeah.
So.
It's really versatile. I mean, you can do treatments where people just have like a little bit of redness for a day and just have multiple of those each month, every month, or you just go all out and just sand it away, baby. Just sand it away.
Smooth it out.
But my grandmother is 83 and she's had 2 of these decas, and she's
really.
I mean,
And what did you call it? I liked your word, social downtime.
Yeah, social
that
downtime.
Means you stay home.
So you don't want to leave the house. Your kids are probably gonna look at you and be like, "What the fuck did you just do to your face, Mom?"
You're like, it's gonna be so smooth.
Yeah,
Little Freddy Krugerish for a couple of days.
Yeah? What was it? Bring the blood
At the
out?
very, very high end.
So just my grandmother as an example, she looked like a Cabbage Patch doll for a couple of days, just with the swelling, and then she had some, not blistering, it was just like some, what is it, the erythema of like pockets and things. Edema, sorry.
Wow.
So
that sounds cool.
Cool sculpting,
Cool
if you've had a few too
It
many.
works.
Cool sculpting
really
does?
well.
Yeah?
Yeah.
Can you get rid of like 25 pounds out of that?
Well, growing up, my dad, always said that I was carrying my own tire around.
Yeah.
Called me saddlebags.
Yeah.
So I've always been a little self-conscious about my love handles.
Yeah.
So I've been just cool sculpting them away and was really impressed with the results.
Well, how does that process work for people that are wondering about it?
Yeah.
Like, what is it?
Yeah, so it's a device. Now it's going to shock cool. It actually freezes your fat.
Okay.
And it freezes it to the point where the cells die.
Okay.
Right? And then when your cells die, your immune system eats them away, and you basically flush them out through your urine. Now, what's even cooler is like no pain.
Right.
You still a little bit of. Have you ever iced an injury?
Yeah.
So it's going to feel like that for about 2 minutes.
Okay.
But it's like 10 times colder than that. So it gets numb right away.
Right.
And then after that, you're golden.
Interesting. Same question with that.
No
Is
downtime.
that multiple?
Depends on the area, depends on how much fat there is there. And we have for the cool sculpting, we do complimentary consults just because everyone is so different.
Right.
Like we go by cycles, so every time the applicator is used, that would equate to a cycle. And usually like the abdomen can be anywhere from 4 to 6 cycles. Somebody has like the bra fat or like the thighs or things like that. So it definitely varies. So we will like map the areas so that people can get a sense as to not just how many applicators or cycles for one treatment, but if you may need multiple. It's sort of like all dependent on what their goals is and what they're looking for. So.
Absolutely. Sounds very like consultative with all of it, which is also probably the differentiator too.
Yeah.
With you guys. And your office is beautiful.
Oh,
thank
you.
you.
Know what I mean? I've been there a few times, and it's awesome.
It's very like gender neutral. We're trying to it's very welcoming for males too.
No,
totally. You
yeah.
want to be like throw up pink everywhere and
it's very nice. It's welcoming. It's warm. You know what I mean? Like, 'cause I think a lot of times people walk into those types of places, and it almost. When I say those types of places, I mean anywhere that you're not comfortable going.
Sure.
You know what I mean?
Yeah.
And it can be a little intimidating.
Yeah.
And when I walked in there, and I didn't have that feeling at all.
Awesome.
So that's good. That's a good thing.
That's
You've done a great
what
job.
we strive for.
Yeah. You've done a great job.
I'll also say my staff is amazing. I mean, they're really quality individuals.
That's what you need.
Caring, and I get so much good feedback from our patients with regards to from the first phone call up until they leave. It's the same type of care.
So that's top down. That's the way it goes. You know what I mean? It's how you guys run the place and how you lead and how you treat people.
Yeah.
The people working for you will do the same. So you've done a good job.
And your team's been fabulous to work
Yeah,
with for
they've been
our mortgages that we've done. So
Thank you. We try our best. You know what I mean?
Yeah.
We really do. And over the years, just like you guys are doing, I try to develop and make improve processes and make things better and try to be different than the rest. And that's the key to growing and taking over a market, and that's what I try to do. And
looks like you've done a good job. See you on every billboard around.
That's the goal. People joke all the time, like, I see you everywhere. I'm like, that's what I'm trying to do. That's the objective here.
Yep.
All right. What else? What other services do you have at MD that people should know about?
Facials, waxings, all that, like anything.
Hormone replacement therapy, so testosterone replacement therapy for males. We also do growth hormone releasing peptides. And we have my nurse practitioner focuses on female hormone replacement therapy.
I just got my labs back.
Yeah.
What's that?
We're very complex beings. No, so I mean, whether you're pre or postmenopausal, our hormones affect so many things. Whether it's sex drive, lack of inability to sleep, all of that stuff. So by just for me, I wanted to do it. Not that I'm necessarily going to take hormones, but I just wanted for my own knowledge of like, okay, why am I feeling this way or not feeling this way, and is it a hormonal imbalance or something else? So.
Well, some of that, it's good to do that stuff sometimes. Like Nicole was going to do, she was like, wasn't feeling well sometimes when she would eat certain foods. So she did like a food sensitivity test. Same idea, right?
Idea.
Let's figure ourselves out, see what's going on. And that's something that people could come in, you could help them out with too?
Absolutely.
All right, awesome.
It's actually a big part of our business. So
Now, I've heard about these IV vitamin.
IV hydration. Yeah.
Talk to me about that. That sounds like it could be great on a Sunday morning every once in a while.
Well, funny you say that. I definitely had to go to a house 2 weeks ago on a Sunday afternoon.
Yeah, we had a
House
40th
calls.
birthday. Yeah, we did a house call, which is not on the menu, but good friends of ours. But yeah, I mean, we've had patients who come in because they know that like they're getting the second dose of their vaccine, and they're trying to sort of get ahead of that horrible 24-hour period. Some of our patients are younger who have like our Lyme disease, have Lyme disease, and we have like the glutathione, and just with his anesthesia background, we actually
we customize
everything versus a lot of these practices are like pre-packaging. So we can definitely make it more customized to the patient.
And same thing, if somebody's interested in learning about that, they can just give you a call and set a time to come in, and you can talk to them about everything.
That's what we love to do is educate.
Yep.
Yeah, that's awesome. That sounds great. I mean, it sounds like you guys have a real kick-ass business going over there. I'm super happy for you guys. I really am.
Appreciate it.